Hello, hello. Did you scare everybody away? Say something? How's everybody doing today?
A little sleepy, but all right.
My sinus
Uh,
killing me. So
poor, poor babies. I pray you all have good health. Ask me questions. What'd you study this week?
you had us study everything all the way to career. So
Ready?
career counseling.
I'm going to add something to your plate. I talked to someone yesterday who had just taken the test. So we add a couple of things here. How are we doing? We feel like we're learning stuff, that things make some sense. Not at all. Okay. So in speaking with someone yesterday who has taken the test, and this is the second time I've heard it, so now I definitely need to add it to my repertoire, is Virginia Satir. In families, I don't always teach her, but it's the second person that I've had that's told me they've had a couple of Satir questions. I'm not sure if they're study questions or not, but I definitely want to make sure that I add that to your vocabulary. So 1 second. She is, when I talk about humanist, she's one of those that she is a humanist. And she has two different theories. One of them really talks about uh, the roles that people play in family, and the other one that talks about how we communicate. So let me just give you some of those terms. Sorry, I'm just creating a document for you with. Okay, so I'm just going to put it in your chat box just so you can have it and you can save it and go over it. And do you recall seeing lots of questions on Virginia Satir?
Good morning, everybody. What I remember is the blamer.
Mhm.
And when I left and made sure, while it was fresh in my mind, I made sure to look up like the placator, the blamer, because I remember the blamer being on mine.
Okay.
And so I remember adding it to my own little study guide so that I can remember like who are the placators, who, so then but the blamer was the one that was on mine. I remember that. And of course, scapegoat, which that was always one of the ones that I remember you telling us, like if it's Virginia Satir, always scapegoat, that's going to be the main one.
Okay. So in your chat box, be sure you download that and save it. That is just an overview of Satir. Okay, and this kind of the communication that she talked about. So that's what I just put in your chat box. So be sure you go over that to add that to your knowledge. Okay. So she's a humanist, and again, she very much really believed. She worked with children, the families that the parents of drug and alcohol users at the time. I just want to add that. I won't ask you about that today, but add that to your study guide, and I'll probably make a video about that. I haven't had that time to do that yet. I'm going to add this one to it as well. Anything else that you wanted to add to the list that I don't normally teach? Edna?
I'm reading it right now.
I'm adding the document I gave you, I'm gonna give you I added the other roles as well. So I'm gonna give you this new document.
Okay. Trying to see, because like on my little study guide that I have the placators, non-assertive. So I'm just making sure that it kind of goes. Intellectualizer is also the computer. Distractor. So I'm just kind of going through it and seeing.
It's a fine line for us because we purposely don't teach everything. Because when we did, we had people getting scores of like 120. And that throws up the average for everybody. And that's not what we want to do. So we want to teach you enough to pass well, but not teach you enough to blow the score for everybody. So what happens is, despite as much as we try to, keep our material in hand, is if I teach it, then it becomes part of common knowledge. And we had people scoring like 110 on an average, and then the average went up to 103. And I don't want that. I need it to stay about 90, 91. And it's the way the test is written, you will never score. You'll never score a perfect score. So if the perfect score is 160, the closest I've seen it's 148. And I can't do that. That's not fair to to everybody in the world to have a score that's high. So that is that we won't do that. Can you imagine scoring 148 on this test? And I've had a couple of people, and no. Okay, so you literally need to get about 70%, a little over half. If there are 160 questions, right? And we figure half is 80, that's 50%. And most scores are between 90 and 100. So we're looking at about 67% of the test, like 2/3 you need to get right to pass. So we try, it's the bell curve, right? We try to stay right there, right in the middle of just kind of making sure we understand what it looks like. Okay, but I just want to make sure that I added that. I teach that for the LMFTs as well. So, okay, other questions? Okay, so let's just look at some questions in general. Anything you want to particular ask me, guys? Something you've gone over, something you've seen?
I have a question because I've seen things about like the DSM-5, the changes. Will we be going over that later on, or?
I have not seen that on the test.
Ah, okay.
So I'm going to Edna, and I'll ask some other people, but I have not seen anything on we're on the 5TR.
Okay.
Now I've seen old questions between the 4 and the 5, but I haven't seen anything on the 5TR. Edna, have you seen that? Okay. So Kathy, where did you see those questions?
I was looking at the questions in Helwig.
So those are from the 4 to the 5.
Yeah, like what are the differences? Like saying like one of them was asking about the axis, that the axis has
They're all gone
dropped.
away. Yeah. But we're at the 5TR. So I haven't seen questions on the changes. But yes, back in the day, we did. I was trained on the DSM-3, and there did used to be 5 axes, but I haven't seen that in current study guides, and I don't teach that currently in my classes. So I have, and again, I usually ask my current, people who've taken the test if they see it. So what I figure is usually what I teach college. So what we're teaching now in college will be on the test probably in about a year. So we're just introducing the 5TR right now to students. So, and I haven't seen, thank God those went away. Do you know how long those have been gone? They've been gone. The 5 is like 15 years old. I don't understand why we were still asking questions on the 4 to the 5. No, have you ever seen anything but a 5, have you? So yes, I think those test questions have gone. Okay. I still see, and I'll ask you, Edna, the dates. I usually still see the importance of the date of uh, when the NCE became a issue, what state and what year. Do we know that one? 1976, and then the state.
Virginia?
Absolutely, absolutely. And that's history. That's what I see history. I've seen questions, especially on the CPCE, about knowing K-CREP and what it means, and how schools became the importance of K-CREP schools, and making sure you're aligned with those. And a lot of people, because this is relatively new, you're one of the newest fields out there. And knowing that, so again, 1976, that's no, I'm old. That's definitely in my lifetime. That CPCs, LPCs didn't exist. Psychologists really cap you out. They did not want you to be part of this field, and they still don't many times. So, but that's at the time and date. That's usually a question that I see. Maybe something about the father vocation, knowing Parsons, and that was like a 1904. Other than that, I don't teach a lot of dates. I try to give you the time frame of 1955 when the birth control was invented. That gives you an idea of when we saw women on the scene. So feminist therapy came then after that. The only women we saw before that would be like Anne Rowe and also then Margaret Mailer. So those were pre-1955. But other than that, we didn't have any women on the scene. So feminist therapists came along after that. So whether we're talking about Carol Gilligan, that she lined up with Kohlberg, or whether we're talking about Gottfriedson, right? Those are all early 60s, mid 60s, late 70s. Sorry, late 60s, early 70s. So just time frame wise to keep in your head. Anything else you want to add, Edna? Anything that you're...
No, I just remember you teaching us to make sure that we remember when it comes to careers about the lack of jobs in World War II. You've mentioned to us about the launch of Sputnik.
Yes.
So if you want to kind of go through that, I remember you mentioning to us about Brown versus education.
So Sputnik, I'll talk about next week in careers, because that's what really changed our view of careers. But cultural diversity is Brown versus Board of Education, and that is really when schools became segregated. So people had to. That's when we really began to look at the multicultural approach. That is, and we still know that now we don't have any tests that are not biased. But before that, it was against the law for blacks and whites to mingle. It was against the law to live in the same house. Did you remember the movie The Help? Okay, so they had the separate toilet, the separate house. If you drive by now, especially in the South, I don't know other areas, but you will see there's still usually a back cottage or something in the backyard, because it was against the law for your help, and they weren't slaves, it was your help, to sleep under the same roof. It was illegal. I know, imagine that. Okay, so that was really looking at, so that happened in 1956 is when schools were integrated.
The Help was one of my favorite movies. It made me laugh. Yeah.
Did you want to make somebody a pie?
Well, she gave ideas. She gave some good ideas. I mean, I was shocked it was that good. She was in it. I was like, Mama, that pie must have been off like good. She must miss that really good.
No, I don't even want to think about that. I walk my dogs and pick up their stuff, and I just can't imagine. It's just the grossest thing ever. Okay. So let's just start off with just vague in general. The test is a combination of some, you really do get some actual some recall. You really do. Not a lot, but you're going to get some. Have we done this before where everybody answers their own answers? Have we done that with you guys? Okay, so here's what we do. Okay, so see at the top where it says new chat. So what I want you to do is I'm going to give you these test questions and you're going to answer just to me. Okay, so when it says new chat, you should click on that and it should say Dr. Pam. Do you see that? Does everybody see that? Say hello to me so I know everybody sees that.
Hello.
No, in the chat. I'm sorry, I did not clarify. You're absolutely right. I did not. Okay, very good, very good, very good. Okay, so you're going to number your questions, okay, and just answer in the chat. We're probably going to do about 20, and then we'll stop and kind of go over them and see kind of where everybody's at. I'll grade them separately and give you your own grade, and nobody else will see your grade but you. Okay, so the first one, I'm going to share my screen. It probably helps. Okay. A trans, yes, you see it? I'll put it in the chat box too. Change the number too. Be sure you put the number and your answer, but you're only answering to me, okay? A transgender teen is experiencing gender dysphoria and social isolation. Which of the following interventions is most aligned with best practices and ethical standards? Okay. A transgender teen is experiencing gender dysphoria and social isolation. Which of the following interventions is most aligned with best practices and ethical standards? A, encourage the client to present as their assigned gender to avoid bullying. B, validate their gender identity and explore affirming support groups. C, suggest delaying identity exploration until adulthood. Or D, focus therapy solely on symptoms of anxiety. Okay, and just put your answer in the chat box again, just to me. I'm going to read and probably go faster than you would like to go. So take your time. The questions are in the chat box. They're still there. You can go back to them. If I read the second one, you're not ready, it's okay. Okay. Number 2, a group leader believes that universality, catharsis, and interpersonal learning are the hidden forces that drive change among members. This reflects what? So a group leader believes that universality, catharsis, and interpersonal learning are hidden forces that drive change among members. This reflects a psychoeducational approach, a process-oriented model of curative factors, a behavioral skills training program, or solution-focused therapy. 3, a counselor challenges a client's rigid statement, I am worthless, by helping them dispute the thought and reframe its meaning. Which theoretical approach underlies this? A, focuses on unconditional positive regard. D, disputing irrational cognitions and restructuring belief systems. C, encouraging awareness through empty chair dialogue. Or D, highlighting exceptions and envision preferred outcomes. Four, a child insists that the sun disappeared because of their anger. Which developmental perspective is most reflected? A, magical reason tied to egocentrism. B, abstract logic beyond immediate reality. C, mature moral reasoning tied to societal norms. Or D, objective classification of objects. Five. Oops.
These are good questions, Doctor.
Well, thank you. A child learns to delay gratification when parents consistently reward them with praise. This demonstrates A, modeling through observation, B, conditioning through reinforcement, C, development of secure attachment, or D, a stage of reasoning. We're at 6. A family therapist directs the parents to switch seats and respond together in one voice, strengthening their leadership in session. What strategy is being used? A, structural experimental roles. B, restructuring hierarchy and boundaries. C, identifying generational triangles. Or D, facilitating catharsis of suppressed emotions. I put that in the chat box.
Dr. Pam, can you put number 4 in the chat?
That's what I said. I didn't think I put that in the chat. Uh, 3. So I didn't put 5 or 6, right? 4, 5, or 6.
Right, correct.
There we go. Sorry about that. Okay. Okay, so 7, a therapist that emphasizes that people are driven to overcome feelings of inferiority and create meaning through social contribution. What framework is this? A, existential authenticity, Adlerian striving for significance, behavioral reinforcement pattern, or structural alignment of family subsystems. 8, a client reports panic symptoms, but the counselor highlights how avoidance maintains the fear cycle and prescribes gradual exposure. This technique best reflects A, cognitive restructuring, B, systematic desensitization, C, psychoanalytic free association, or D, the solution-focused scaling. Nine, a counselor stresses the importance of genuineness, empathy, and acceptance as the soil where change grows. This most reflects person-centered foundation, a behavioral shaping model, an intergenerational transmission pattern, or a cognitive disputation process. A family presents with rigid rules, lack of flexibility, and extreme distance between members. The counselor's main task is to loosen the boundaries. What model guides this? Structural family therapy, strategic reframing, narrative reauthoring, or Bowen's intergenerational analysis. "11, a client says, I'm a terrible mother. The counselor replies, you feel guilty and afraid you're not living up to your role. Which counselor response is this? Reflection, paraphrasing, summarization, interpretation.
Is 11 supposed to be 10?
Did I miss a number? Oh, I'm so sorry. Thank you. Yeah, I can count. Sure. Okay. Everybody got that? Thank you.
Dr. Pam, number 10 is the one that says a family presents with rigid rules, lack of flexibility. So the one that you just put 10 should be 11.
Okay, so 10 should be,
A family presents with rigid rules, lack of flexibility. You put it on the chat.
Okay, did I skip it on the?
It's I think you deleted it from.
Okay, hold on. Okay, I'm so sorry. Let's go back. Okay, so 8, 9, okay, 10 is here.
Yeah.
Okay, so then this one's 11. Okay. And this one's 12. Okay, thank you.
Yes, thank you.
That, Tamika, you put it here. Don't put it here. Directly to me. Okay. So 11 is I'm a terrible mother, so make sure we got that one right. And then 12 is a counselor who has a client who's African American, 25-year-old male. He's been relatively nonverbal even after meeting him for 6 sessions. The counselor does not understand does not understand his client's behavior and believes that buy-in from the client is very important to a good outcome. The client likens this behavior as he has seen it before in counseling when the clients are quite willful. The counselor meets with the treatment team and labels him as resistant. The labeling is a result of A, resistance, resistance is resistance, B, countertransference, C, cognitive dissonance, or D, burnout.
Miss Tamika, your number 7 is on the wrong chat. I don't want you to lose credit.
Yes, I figured that out and corrected it. I'm sorry.
I'll say she went back and fixed it, yeah. Okay.
Dr. Pam, how many are we going up to?
20.
Okay, thank you.
13. When a counselor uses the phrase, what's the difference about the times when the problem didn't show up? They are most likely A, gathering a behavioral baseline, B, exploring resistance, C, opening a space for exceptions, or D, confronting cognitive dissonance. In a family session, a child begins to cry when the parent speaks, even though the content is neutral. The counselor should first interpret the family dynamics, redirect the child's emotions, ask the child what they're feeling, pause the session to allow the moment to settle. When working with a client who communicates very little and often deflects, what strategy is most effective? A, use silence as pressure. B, offer interpretation early to move things along. Ask what the silence feels like, or refer the client out due to limited insight.
Dr. Pam, are we sending them one by one, or because I just been answering them and I was just gonna send them all at once?
So no, I want you to enter them in your, well, okay. So what I'm going to do is take the information from the chapter from here and put it in my grade book. So it'll grade it automatically. So
Oh, okay.
answer them one by one is easier
Okay.
in the chat box. Did I put that one in the chat? That one, 14, 15, 13. I put it in the chat box. Okay. So 13, 14, 15, yes. $16. A group member begins to dominate discussions and offer unsolicited advice. Over time, others withdraw and share less. The counselor's best response is to A, redirect the group member privately after session. Invite the group to reflect on invite the group to reflect on how space is shared. C, encourage quiet members to speak more. Encourage structure through a new group agenda. $17. In a wellness group for older adults, the counselor frequently says things like, sweetie, just sit tight and we'll help you with that. And let's slow down so we don't get confused. One group member suddenly stops attending. What is the most clinical concern? A, the counselor's language may reflect subtle invalidation of incompetence. B, the group lacks structural behavioral goals. C, the group member has age-related memory issues. Or D, the counselor's warmth may have overwhelmed the group. A teenager at 18, a teenager shrugs and avoids answering most questions. The counselor notices that when the teen does speak, the parents quickly jump in to correct or rephrase them. The teen then withdraws again. What's the best next step? A, explore the parents' values around communication. B, redirect attention to the teen's silence. C, highlight the potential functioning of the interruption plan. Or D, increase the use of structured emotional labeling. '19. In a section focused on family communication, a counselor asks a member to compliment another person's effort once a day and to track the results over a week. This most reflects A, cognitive reframing, B, externalizing negative cycles, C, structured reinforcement for positive behavior, or D, development attunement. How you feeling?
I don't like this.
I feel like I'm in the test. Whew.
Trying to make you feel like you're in the test. Okay. In a session, a client says they feel emotionally paralyzed and don't know where to begin. The counselor decides to co-create a plan that begins with structured daily actions. This decision best reflects A, a desire to avoid emotionally overwhelmed, maybe. To avoid emotionally overwhelmed. I think that's ED. An imposed solution lacking collaboration. A strengths-based approach grounded in behavioral momentum, or a distraction from deeper work. Okay. Does anybody need more time?
Definitely. I'm only on 14.
Okay, take your time.
Yes, me too.
Yes,
Take your time.
please.
And we'll close it out just for a minute so I can put the whole thing in your chat box. Okay, the whole test in your chat box. So I can have it all at the same time if you'd like. Everybody's getting their own individual grade score and kind of suggestions of what works for you. We'll go over in just a minute. And you don't have to share anything you don't want to share. I just want to give everybody their own first. Who haven't I done? Who hasn't got their score? Shayna, I don't think I got you.
Me.
Me too.
Sheena and who else said me too?
Me. Tia.
I thought I gave you yours. There's a doc in your chat box.
Okay.
Just open the doc. Okay, everybody have their scores? Okay, anybody surprised? Want to process it?
I like the fact you explained to me why I got it wrong. I was like, okay, because like I was debating on one of these two answers.
Which number was that?
While Satya gets her stuff for you, mine helped me to see, okay, I missed something on family and I missed something on behavior. And I know
Mhm.
that those are the ones that I need to be going back to and maybe giving more time.
Mhm.
You know, so those are the two areas that I know I need to give a little bit more attention to. So mine was very helpful.
So I will tell you that again, I said, so for the test, you really only need about a 70%. I would say if you scored 75, you're good.
I always forget, and what I need to just study better is structural and their keywords and strategic and their keywords, and be very confident in, nope, that is structural and this is strategic. Like I know that without a doubt, and that's the part that gets me with structural and strategic. But this
I'm
was
with you, Edna. I'm with you on that.
very helpful.
Okay. So think of structural as tore up from the flow up, boundaries, hierarchies, subsystems, all of those things.
Mine
Okay.
was the knowing the words, paraphrasing and what was it, paraphrasing and
Those are active listening
Reflection.
skills. Okay, so we
yeah.
can go over those. Okay. Okay, so let's just go over them in general. Okay. So first of all, everybody did pretty decent. Okay. I'm not going to say you did pretty decent. Now, again, you only got your scores. I didn't share your scores with anybody. And also, you should have gotten what areas that you need to work on. Okay. So it's a pretty good comprehensive kind of guide of what you need personally. Okay, so which ones gave you trouble? I can tell you that. Let's see, which one did most people miss?
I put question marks next to the ones that I really was unsure about, so I could go back and double check.
I'll say for me, looking over the ones I missed, the answer that was correct, that was my second option from the majority of the ones that I got wrong.
Well, that helps. So how do we figure out to narrow down when we get to the two? Okay, let's see. The most missed was 13. Okay. So when counselor used the phrase, what's different about the time when the problem doesn't show up, they're most likely. Is it, don't you recognize that? What theory is that? When is the problem not a problem?
Solution focused group therapy.
That's the accept question. So what was I looking for?
Some that deals with solution focused group therapy.
Opening
okay.
spaces for exceptions. Oh my gosh.
Got it.
I
That's
totally
the
didn't see that.
accept question. That's solution focus. When was the problem not a problem?
I had that running through my head, but I completely didn't see for some reason. I read them and I was like, it's not here. Why isn't it here? Oh my gosh.
Okay. So this is, and again, this is what I believe the test is like. I do a lot of research on people who take the test. I do practice questions. Tell me, how close am I? What does this look like? So I really have worked really hard to come up with what I believe the test questions look like. Okay. So this is what I'm trying to prepare you for.
And this really is it. Like I really felt like I was in there, because it is. You really have to just recognize it and every time that we study and we do our videos and all that, and then be able to say, okay, it's not gonna say solution focus, but this is dysphagia for sure. You know, and that it's so hard.
So, and I would ask you then, because one of the biggest struggles that I have is if you ask me what is y'all what is I could regurgitate it, but to apply it to a question is it blows my mind. How do you do that?
So I don't think you know it. I think you've memorized it. Because if you know it, then you know it. So you can probably tell me y'all insecurity factors, but do you know what they all mean? So that's the issue is do I know it? So this one, I thought this one was pretty easy. If you know solution focused, right? Tamika's like, no. Okay. But when is the problem not a problem? So that's what I'm looking for. And it gave you the exception question. So sometimes the answers won't give you that, but at least gave you the exception question there. The next most missed was 20. Okay. So in a session, the client says they feel emotionally paralyzed and don't know where to begin. The counselor decides to co-create a plan that begins with structured daily actions. This best reflects what?
I use common sense on this one. I'm gonna be honest
Okay,
with
so
you.
what'd you come up with?
I came up with C because I knew that desire to avoid emotions overwhelm. You know, we can't avoid the emotion because he felt paralyzed. Then I said, it's not distraction from deeper work. What we distracting him for? So, and you know, we collaborate with him. So I got down to B and C, but it's not lacking calibrate, working together. So it got to be C.
So this is a treatment planning question. Do you recognize that? So this is, or he doesn't know where to begin. And it said that the counselor decides to co-create a plan. That's treatment planning. We don't ever do a treatment plan without a client. Do you recognize that in the question?
I recognize the co-caring, but not that it was treatment plan. But you're right though. You can't. You
That's
can't.
treatment planning. You cannot write a treatment plan without a client, right? So we can't tell them what to do. The next one was 18. Okay. A teenager struggles and avoids most questions. The counselor notices that when the teen does speak, the parent jumps in quickly to correct or rephrase them. Then the parent with the teen withdraws again. What's the next step? So what's this question trying to measure? They won't let the kid talk, right? If I don't know any therapy, they won't let the kid talk. In a family, everybody gets equal say so. So process with me, Joe. What were you thinking on this one?
I was stuck between A and B in that one. Or I'm sorry, A and C in that one. So I got that they wouldn't let the kid talk.
Mm-hmm.
And I knew that, asking the kid, hey, why are you being so quiet? Probably wouldn't be helpful. If the kid is being quiet, he's probably not going to have a lot to say about that.
Okay.
I knew it wasn't D, just because, again, we can sit there and talk about structure and emotional labeling and all that, but if the kid's not talking, the kid's not talking. That's nothing to do with it. I just really struggled between A and C. The exploration of parents' values around communication, and then highlight the potential function of interpretation patterns.
So I'm going to tell you, this is a behavior question. Do you see any feelings in the question?
No. So values would
There's
refer to feelings.
feelings. There's no
Yeah.
feelings in there. This is just behavior.
Yeah.
This is what the parents do, and the kid doesn't speak. The kid gets upset, the kid cries. There's no feelings.
Right.
There's
And
no
so values
nothing.
would be relevant only if there were feelings in the question.
Absolutely.
Gotcha. Okay.
There's nothing in there
There it is.
at all that talks anything about how they feel.
Okay.
So this is a behavior question. All I want to do is change the behavior. This isn't okay.
Yeah. Okay. Yeah, I got that it wasn't okay. The values bit, and then I got lost. It says the word communication. So when I panicked between A and C, I went with that one.
Okay. So again, what I'm looking for in that particular question, there are no feelings. There are no feelings at all. None. Anybody else want to talk about that one?
Tina said she got two correct. That was incorrect. She want to read his stuff.
Which one?
I got number 8 and number 9 correct.
Hold on 1 second.
Well, I had missed 18.
Okay.
And
so 8 was
trying
you
to
had-
recognize.
Hold on. So 8 was A. No, A was B, and you entered A.
For number 8?
Uh-huh.
No, for number 8, I have B. You put that I had A, but in the chat I put B.
Okay.
And the
hold on.
correct answer is B.
Okay, hold on. All I do is go back and put it in, and let me see. Okay. I've definitely been known to make mistakes.
And for number 9, I put A, which is the correct answer, but on here, on my thing, you put that I put D.
I did. Let me do that again. I apologize.
Dr. Pam, on 19, can you explain why the answer was C?
If you give me 1 second, let me regrade hers because it didn't
Okay.
pick up the numbers. Okay, so 5 was A, 5 was B. Okay, so it didn't pick up your numbers. Seven is
And Dr. Pam, I don't know if you know, you can.
okay. Do you see your number 7? It says 6.
Yeah, that should be, hold on, because I had to take
so
pictures.
that's that. Yeah.
I had to take a picture because I was putting it in, I believe it should be B. Number 6 should be B for me.
Go ahead. Somebody said something. 6 or 7.
Oh, I was just saying, I don't know if you know, but in Zoom, you can do put these questions in as a poll and we can answer them that way too.
I do it on my Facebook page.
Oh, okay.
I do. That's what I do on my Facebook page. I'm using ChatGPT to grade it, so that works better. But on my Facebook page, it's usually in a poll. Okay, 6B, 7. The way you put yours in just didn't work out well in my. So 7 was what?
Sorry, I muted myself. It should be B.
Okay, what was your question? Somebody asked me a question.
Mine was like 19. Can you explain to me how C was the answer?
Mhm.
Because I was really stuck on that one. Like,
Give me one
super
second. Let me
stuck on
just-
that one.
Oh, I'm sorry. Let me do that. Okay, try again, Sheena. That should go better. Okay, so 19. Okay, let me go back to the ones I was going down the list, the ones that were missed the most. So hold on. I was at. Wow, so that did not make the top list of ones that people missed. Okay. Okay, so in 19, and let me go back to sharing. I apologize. In a session focused on family communication, a group member is asked to compliment each another person's effort once a day and track the results over a week. This most reflects. Say, tell me about the question.
So the question is asking what family communication is being used when the family is complimenting each other once a day and tracking the results.
It asks me what type of family communication is being used.
No, it said no, yeah, it is using what family type.
It's not asking me that though. It's asking me not necessarily what kind of communication. It's asking me what the behavior is, right? I ask everybody to compliment everybody to once a day to compliment people and keep a journal.
I
That makes
think that's
sense?
why I got it wrong. Yeah, because I read the question wrong. See, that's I ain't gonna lie. That's what happened to me with a few of them. I read the question wrong. And then I'm like, when I heard you hear it, I was like, ah, like, really? Where
Okay,
was
so
my
that's why I
brains
asked
at? I
you.
know where it was at.
Okay. So I think what you read was they're how they're communicating. That's not what the question's asking you though. It's that question's asking you what was the intervention? I said I want you to track down every time you say to compliment everybody every day, and then keep a number of it. So what did you pick?
I was stuck on I was really stuck on this one. I think I picked A on that one. Yeah, I believe I
Okay.
picked A.
And I could have
Yeah, I
gone
did.
there. I could have gone there because
Me too, doctor. I picked A.
so I could have gone there because CBT does say keep a journal, right? Because part of it's journaling, but I'm asking you to keep a number. I'm asking you to keep a tally. How many times today did you do it? So all I want to do is you did it, and then I want to keep count of it. Okay, so I'm reinforcing. That's a behaviorist. I'm reinforcing your positive behavior. Compliment another person's effort once a day and keep a tally. Cognitive reframing, I would have talked about changing the way that you think.
And what I did, doctor, it was I said, oh, look, there's family, and I'm gonna refrain because they're a family. And so it's gotta be A without a doubt. That's what I did.
Okay,
I
so
was stuck on that one hard.
but
I was like,
I didn't teach them anything new. I didn't change the way that they think.
I was thinking about how that activity would eventually change the way that they begin to view each other and thought about each other.
Oh, but you're thinking too much. It didn't ask
Yeah, I
you
was
that.
about to say, I clearly am reading
It
far
didn't,
too much.
yep, it didn't ask you that. It asked you. All it asked you was to track their behavior. So that's a behavior. Let's see. The next highest one was missed was I think it was 19. Let's see here. So we did 13, 20, 18. Did we do that one already?
yeah.
We did that one. Okay. And then 11. This is the one we don't know. We've got to work on those active listening. I'll give you some of those. We can go over those. Okay. So what is reflection?
Talking back to the client about the feelings.
Giving the feelings words the client didn't say. Absolutely. Paraphrasing is how you got through grad school. You put it in your own words. Summarizing is usually at the end, or a big chunk of material that you've learned and you've talked about. You're going to kind of wrap it up at the end. And interpretation is having them see it through a different lens. Now, when I see interpretation with Freud is going to tell you what this really means. But this one, interpretation, is having you look at it differently. So reframing belongs to structural, and relabeling belongs to strategic, and they mean the exact same thing. Okay. So tell me how you process this one. Kathy, did you get this one right?
Yes, I did.
Okay. So tell me what you were thinking.
When I saw the client saying like she's saying that she's a terrible mother, and then the counselor adding the feeling words like you feel guilty, afraid. Then reflection came to mind because of the
Yes,
feeling.
exactly. And she didn't say that. So the feelings words are the ones that she didn't say.
Mhm.
Joe, did you get that one right?
I did, yes.
Good. Very good. Good. You had a very good idea what reflection was. Okay. Let's see. That was 11-12. Oh, a lot of people missed this one. I had to run to the restroom, guys. I'm sorry. I'll be right back. We'll process that one.
12 confused me, y'all. I was sitting there like,
I don't know about the rest of you, but this scared the bejesus out of me. I'm not ready. I'm not ready. I'm not something. I just asked Edna, I was like, how do you study? Because I'm studying and these questions, I was like,
It
yeah,
really puts you like into perspective, right? Like, oh my God, I don't know family as much as I thought I did. Or I don't, I need to improve on behavior, because like behavior number 19 or whichever one she just did, I mean, even right now, I couldn't tell you that that was behavior. So I'm not
right.
catching things. I'm not catching when it's a behavior question. I thought it was a family question.
that's what I'm saying.
Me too.
What do you do? Are we like, I need a process. Like, I need a process of how to study this stuff to apply it to a question. Because just studying the things that we're reading, like she says, I'm basically memorizing it. So then how do we transfer that process to applying it to a question like these? Does anybody have any things they could share? Joe, your face is hilarious.
Sorry. My face makes faces, or my face says things. Honestly, yeah, no, I'm with you on that. My biggest problem, and this has made it blaringly obvious, is that I overthink. Like with the other question she just did, I was like, oh, it's definitely, CBT, because doing that the whole purpose of doing that is to restructure how they see each other, change their cognitive processes about how they view one another. So it's definitely that. And I'm diving way too deep into the questions, and not being able to take them as face value. So I'm right there with you in that sense. Yeah, this sucks. I hate standardized testing so incredibly much. I've been doing this for, like 6 years, the counseling for 6 years, and I'm just terrified of standardized tests. And so I've put this off for ages, which is why I'm stupidly doing this right after I had a baby. But no, I'm with you.
But this is why she says all the time that we may be good counselors and great at what we do, but we suck as test takers. And she says it on
Yep.
one of my videos, and it's the truth. I do great, with immigration, but I suck at taking a test. So that's why this is already the second time that it's like off by one question because of this, like what we're doing right now. So
Yeah.
we're all there.
I'm with Joe. Sometimes I overthink. I be like, my brain, oh, I gotta do something else. Like I have ADHD, y'all. My brain was going thinking about something else. Then I had to like read the questions out loud for me to understand. Then it still didn't get me. So I was like, yeah, no, my brain don't want to work today.
Do you have a
It
private
barely worked
room?
today. I need to get a private room because I literally read out loud. Like
Yeah.
like I might have to like
Yeah.
probably get one, but then at the same time, I don't know. I'm gonna figure it out though.
Why would you not ask for a private room? Why would you
You
not ask for
think
accommodations?
I was asking for accommodations, but then when they wanted me to have proof of it, I was like,
You don't have a doctor?
You don't
it
have
was gonna
a
take me
therapist
long
friend?
to get to my doctor.
I'm sorry.
What'd you say, Joe?
I was gonna say, you don't know another therapist that would, you know, do a little evaluation on you.
What about your doctor? What was that about?
My doctor was gonna take too long. I already know it. Like by the time I wanted to take the test, it was gonna be way past what it is.
Does she have to see you to to sign the letter?
Yeah.
Have you mentioned it to your doctor?
No, I might actually do it. I'm gonna do it. No, I'm gonna do it. I'm gonna do it because I'm gonna need it.
Okay, so just in general, you don't have ADD, and my life is just so much easier when I take the meds. It's just so much easier. Well, not just test taking, like cleaning my house or focusing on anything in general. I can't without it. I can't. Have you tried like coffee or the other stimulants? Because all of the medicines are stimulants.
No, I don't like coffee.
How about
I
energy
never
drinks?
liked coffee. I don't even drink energy drinks.
So I'm just saying that. So that's what the treatment for ADHD is. You take a stimulant that has the counterindicated the opposite effect of you. So that's what the medication is. It's a stimulant. So many times people, well, that's why you drink the energy drinks, because it makes you feel normal. Okay. Okay. So how do we process 12? Who got it right? Well, somebody did now.
Well, I knew it was indeed.
I did.
It wasn't burnout.
Okay, so tell me what words in the question help you get it right.
When it said the counselor likens it to behaviors he's seen before. So he kind of judged it on past experiences.
Absolutely. Absolutely. Absolutely.
Oh, I didn't see that. I didn't see that. Did not see that. See, I knew I didn't read that. See, I knew mine is not reading it like I supposed to. I need to read it slowly because I did not see that.
Okay. That's going to kick your butt on the test. It really is. It's a reading test. Everything in there matters. It matters. It matters. It matters. It matters. Okay. He likens it to behavior that he's seen before. So that's countertransference. He's bringing his stuff in there. And quite willful. Willful's not a nice term. It's like, they just come and do what they want to do. 2 was the next most missed one. Three people missed that one. How come? A lot of people put psychoeducational. Who missed that one? Okay, I won't call you out, but I know who did. Okay, so this is, did we not recognize the word? This is Yalom. Those are Yalem's curative factors. Catharsis, interpersonal learning, universality. Those belong to Yalom. Number 8. Okay. So this was systematic sensitization. The key is the counselor highlights how avoidance maintains the fear cycle and prescribes gradual exposure. Right. And 15. When working with a client who communicates very little and often deflects, what strategy is most effective? Deflects means they they put it back on somebody else or something else. They're not going to focus on it. 3 of you picked A or D. Oh no, that's not, it's 15. So that one, the answer is C, and 3 of you put A or B. Anybody want to talk about that?
I kind of had the same thought process as I did in the other one, which probably means I was thinking too much. The client's communicating very little. So once again, asking them a question seemed kind of like, if they're already not communicating, asking them a question probably wouldn't get you very far.
Okay. Well, I'm not gonna pressure him, am I?
No,
I
it's
wouldn't
not gonna
pressure
work.
him.
I knew it was either A or C because of the silence part.
Okay.
So my second choice was the right answer.
So D is I can't refer the client out. That's not an option. He's my client. I can't refer him out.
And it's unethical to be doing that like that.
Okay, so I should have been between those two.
Yeah, I was between B and C, and I put C because you can't offer interpretation error to move things along.
How come?
You I got it as, like I said, I use common sense. You're not gonna be able to move on. He already accumulates very little, and he often deflects it. So I would have asked, what's the silence? Asked about what silence feels like.
Okay. So I can interpret it, but I don't know enough. He hasn't said anything. So instead of interpreting, let me just ask him. Okay. Any other ones you want me to go over?
No, but well, let me not speak for everybody else, but could we go back to this particular question? Like I said, I eliminated B and D, so I had A
Okay.
and C as my choices. I
Okay.
did A, use silence as pressure. I know silence is, an element during the therapy process, but ask about what silence feels like. And that goes to the who communicates very little and often deflects.
Mm-hmm.
Okay. I just want, because I was like, when I was reading it, I was like, but there isn't any silence. So what silence?
He communicates very little.
But then
and
he
when
also
I ask him a question, he doesn't answer it honestly. He deflects. He's avoiding the feeling.
Did you
Dr.
do number 20?
20?
Did you review 20?
I don't know if I did or not. I did.
Okay.
Did I? I don't know. It was a treatment plan. That was
You
that's treatment
did.
planning.
It was C. She did.
Okay.
That was one of the beginnings. Sheena. See, my brain. I'm sorry. I knew I said your name wrong. I just said it out loud wrong.
Okay. So I will give you some study material because obviously we're missing those active listening skills. I've got to give you those. Those are in chapter 3 of the Helwig book. And we are going to careers.
We're going back to doing careers.
Do we
We
do
already
careers?
did. We already
We
did
did careers?
careers, doctor. We're going to
I am
read.
so sorry. We are. And I should have tested you on careers today. I didn't do that. I am so sorry.
That's one of the areas I struggle with most, just because I've never performed in that area, clinically.
Nobody ever does. Honestly, you don't get paid for it. So unless you're like a high school counselor, no one ever does careers. Okay.
That's
so
what made me confused about them putting it on the test. I was like, why is this here? This don't even relate to us any form or fashion, his own way. Oh, I hated career counseling. Just they put that on there too.
Don't know why. And I should have thrown in career questions on there. I apologize for that. Okay, so we're going to research and assessment, go back and pick up careers, and I will send you some information on active listening skills. Okay, are we good?
Yeah.
Okie dokie. Today gave us an eye opener of where you're at, what you need to know, and I really hope a feeling of what the test questions look like. So, you know, when you get there, you don't freak out. It's not the purple book. It is not, you know, Jack and Jill ran up the hill. It's not like that. It's really vague. Okie dokie, guys. I will see you next week. Actually, I won't see you next week, will I?
Well, why
I
not?
won't. It's the 20th. Is that next to the 20th? No, it's in the 21st.
21st.
Yeah, so
It's
yeah,
the
I'll see you
21st.
then. Yes. We're having our first annual virtual conference on the 20th. So I will see you next week.
So you will.
Bye, guys. Yes, I will.
All right. Thank you.
Bye.
Mm.